We're going to go over borderline personality disorder, which in my experience is often misdiagnosed as bipolar or something else. So today I'll explain what this is in a simple and easy to understand way. Here we go. The most common symptom in borderline personality is actually mood swings, which is why these folks are often misdiagnosed with bipolar. Particularly struggles with anger are very much present. In general, their emotions are felt in a very intense way. Another very important point is that perhaps the core issue is a fear of abandonment, which will cause them to act in drastic ways to avoid a perceived abandonment. This will then lead to a lot of interpersonal conflict and unstable relationships. Folks with borderline personality will often go back and forth between idolizing and devaluing their loved ones. There's often struggles with self-esteem and self-image. Other unique and interesting symptoms that can be present are dissociation and even, for lack of better words, paranoia that is very much temporary and caused by stress, so that when the stress goes away, so does the suspicion of others. People with borderline personality disorder will also have chronic feelings of emptiness. And finally, and perhaps the most important point, is that the reason we are most concerned about borderline personality disorder is impulsivity is present, which in the context of suicidal gestures could be quite dangerous. At this point, you're probably thinking, whoa, that's a lot, but it shows you the complexity in trying to diagnose something like this. So once it's there, how do you treat it? Luckily, there's a very powerful tool, extensively studied, and that is dialectical behavioral therapy, or DBT. Future video to come explaining what that is. For now, understand it's a type of therapy very powerful in treating borderline personality disorder. From a psychiatrist's perspective, there are no FDA-approved medications, so the focus is oftentimes therapy or symptomatic treatment with medications of depression, anxiety, which is almost always present.